Good evening. Namaskar from Medica Hospitals. We have been facing a lot of queries in last many months. So we thought, why not we come out with a series of webinars, which is being held every Saturday between 5:30 to 6:30, 1 hour, where we like to deal with the important healthcare issues of that point of time, at that point of time. And nothing could be more crucial than talking about, do we really need booster? As our Honorable Prime Minister has agreed for precautionary booster. And why do we need booster, and how does it help us in saving ourselves from this deadly disease, which was unknown, unseen, unheard till 3 years back. Today is the third year. We are in third year now. We saw this disease, got hit by it in 2020. First version of COVID-19 was like an earthquake. It not only shook us, it kind of woke us up from the slumber, and we realized that earlier, when anybody comes to the hospital, his life is at risk. But here we realized that health workers are also at a huge risk, and that changed the complete equation. We realized that we could also be affected. And as we stand today, the COVID has affected over almost 29 crore people in the world. In India, currently the active cases are approximately 2.93 crore are active cases. And all of that, serious cases are 89,849. These are the figures of today till morning at 11 a.m. all over the world, global figures. USA has got more than 5.56 crore people infected. India has got more than 3.48 crore people who are infected. We have lost close to 54 lakh people all over the world. And these are some of the figures which have been reported. These are not the figures which are true pictures, because we know that there's a difference between the numbers and the difference between the what is available to us in public domain. Now, we have all gone through COVID, and we have realized that immunity after COVID lasts for approximately 9 months, as was claimed by Dr. Balram Bhargav, the ICMR Director General. And we also know that hybrid immunity is much better immunity. That is, when we have got an infection and we take a vaccination too. And as they say, vaccination is necessary for better protection, even among those who have had the infection previously. So there's no alternative to vaccination, because there's no settled medicine for the disease. There's a serious concern of Omicron, what is happening in the world. Now, we know that Omicron has a great potential for quicker spread. So somebody, I was reading somewhere, said that the first 2020 was earthquake, 2021 was tsunami, and this is a death storm. It will reach everywhere. It'll enter into your ear, it'll enter into your shirt, it'll enter your socks. It will affect every segment of population. Fortunately, it's much a milder version, but that does not mean, because we don't know its full extent to which it can affect us. We just know what we have seen. Remember, this disease, what this new virus, what we have found, is just 1 month old, 1 month and few days old. And already 110 countries are under its grip. So it can't be taken very lightly. It has a potential for quicker spread, but it does cause milder disease in people, potential to evade detection by normal standard diagnostic tests, and it has a diminished susceptibility to treatment. Even to the monoclonal antibodies, what we call cocktail these days, it has a diminished sensitivity to even that. And it has a potential to evade natural or vaccine-induced immunity. India already has reported 1,432 Omicron cases so far. 1,432 for something this has started a month back. Now, Omicron is the new dominant C19 in US. You know that US has detected 580,000 cases steady, which was doubled, and it is infecting the essential workers. My problem is not that people will get infected. Our problem is that if the essential services get affected, in USA, they canceled 1,000 flights a few days back because the airline workers were infected by the virus. We are seeing the serious spread in the hospitals. All our hospitals, all medical hospitals have got people who are infected. Our vice chairmen are infected, our head of the administration is infected, many of our colleagues are infected, nurses are infected. And that too, when we are extremely cautious, we have a double mask, and we all are extremely careful because from last 2 years we have been practicing it. Outside, the public may not be as careful, but we are extremely careful. And in spite of that, our people are getting infected. That's a very serious worry we have. They say, fortunately, the symptoms reported so far include headache, myalgia, fatigue, and no hypoxia. Means very few have required oxygen supply. So that's a very positive thing. But once one gets infected, he has to be quarantined. That means his movement, his business, his traveling. I just got a call from somebody, young man, who traveled to Sri Lanka. And as he was getting into the flight from Sri Lanka coming to India, his RT-PCR became positive and he's stuck there. Many of you, if you are traveling, might get stuck like that. Today, there was a news item where a woman in the flight tested positive while she was in the flight. And they had to lock her up for next 3 hours in the toilet. So that kind of impact this virus will have it. A Japanese study has shown that Omicron is 4.2 times more contagious in the early stages than the Delta variant. The doubling time of virus in documented community transmission is 1.5 to 3 days. That means if 10 people are infected, in 1.5 days, 20 will be infected. In another 1.5 days, 40 will be infected. You just calculate that how fast. It's truly a death storm which is going to affect us. Now, we had a leadership decide about precautionary doses. What does it mean? Precautionary doses means they are meant to lessen the severity of infection, hospitalization, and death. Vaccines are disease modifying and do not prevent infection, but they modify the disease and make it less infective. And in just to give you some number, that in last 7 days, from 21st to 27th in USA, the average of children falling sick has gone up by 58%. Here are some of the statistics which you have culled from the literature. And the 3 C's of communication and transmission is crowded places, close contact setting where conversations are very near to each other. When you sit on a dining table and talk to each other, or you are in a closed space. And third is where there's no ventilation, poor ventilation. 3 C's are going to create transmission and spread very easily. So we thought that we will present you that why the precautionary dose is important and what this booster means. I have with me Dr. Aviral Roy. He's our senior consultant, critical care and internal medicine. He was trained in USA in internal medicine, and he was trained in critical care in USA again. He's with us for last 5 years, and he kind of deals with these cases on day-to-day basis. I'll hand it over to Dr. Avril Roy to explain what does it mean by the vaccination and how does it modify the immunity, and how can it help, and what needs to be done at this point of time. Dr. Avril Roy.
Thank you, Dr. Roy, for that wonderful introduction. Hi, everyone. I'm Avril Roy, and I'll be talking to you about vaccination and boosters. I'm, like Dr. Roy mentioned, I'm a consultant critical care and internal medicine at Medica Super Specialty, Calcutta. Let's moving on. Just confirming everybody can see screen, right?
Yes, we can see.
Perfect. So this is what we're dealing with. This is an electron microscope capture of our coronavirus. What you see, the green area is that spike protein that everybody talks about. And that is the spike protein is the thing that is what our antibodies and our vaccines are designed to work against. The orange called yellowish orange core that you see is the main body of the coronavirus. The reason it's called a coronavirus is because it looks like the sun. The word corona basically means crown. It looks like the corona of the sun, or it looks like a crown of spikes on this ball, sun-like ball. So coming straight into it, what are these variants of concerns, VOCs you keep hearing about, alpha, beta, gamma, delta? Special mutations in the virus which make it either more infectious. What does infectious mean? It transmits more easily, more virulent, which means the severity of disease caused by this variant will increase, or it becomes more resistant to vaccine. That means it causes more immune escape. So if you are immunized, you are more likely to get disease from these variants. What we call the original variant is the Wuhan variant. We will not talk about that. That's the original coronavirus. The first variant of concern that we detected was alpha. It was first detected in England. That was more infectious. So it met option 1. We had no vaccine back then. So that one was more infectious. It was easily transmittable. After that, we had beta, which was detected in Brazil. That was found to be more virulent. That means it caused more severe disease. Then we had gamma, which was detected in South Africa a little later. That was found again to be more infectious, but not really more virulent. And we had no vaccine yet. And then finally, we had delta, which was first detected in India. Nobody needs to be told about delta. Delta was not only more infectious, but it was also more virulent. So what does that mean? Because it was spreading so fast and it was having a very, very quick, very, very high viral load in the body, it was causing very, very severe disease. Moving on. So this is a diagram which shows basically the center is how the coronavirus started out, and you can see all the various variants of concern. The main one being, you can see delta, which is the current most common variant in the world. And as you can see, it is starting to branch out into many sub-variants, delta 21, delta 21i, delta 21j, but that's not important. The important thing is this new one, the red Omicron, which is a brand new variant that has formed. And then you can see, the further away you are away from the center, the more distinct, the more new, the more original this virus is. And because it's so far away from the center, and that's what makes it very, very easy to escape the vaccine, because it is so different from the original center that the vaccines were designed against, that it's easier for this variant to escape from vaccines. Moving on. This is our culprit. This is the Omicron variant of the coronavirus. This is again a molecular view of this new spike protein that Omicron has. Anything that you see that is red, those parts have been deleted. What this blue and gray is the original Wuhan spike protein, and the red is parts that have been deleted, yellow are parts that have been modified, and green are parts that have been added to this. Doesn't mean much, it's just a diagram. But what it doesn't mean effectively, The image by itself doesn't necessarily mean much. Omicron is derived from the Greek letter for small o, that's Omicron, as opposed to, you might have heard of Omega. Now, the WHO, when they first saw this variant in Botswana, was so concerned that within 2 days of the variant being discovered, it was already designated a variant of concern. And the interesting thing is, the first case in India that was detected on the same day. That means the sample was collected on the same day that the WHO actually discovered this variant and made it a VOC, which means this variant was already undergoing what is called community transmission in our population, even prior to even people knowing it existed. So what are the unique features? It has more than 30 mutations on the spike protein, out of which more than 15 are what's called the RBD, the receptor binding domain. And that is the part of the spike protein where the antibodies that your body produces and the vaccines work against. It has already replaced Delta as the most dominant variant in South Africa, in America, in Europe, and it's what's driving this massive spike of cases. Yes, you might have heard people say, it's not so severe. But remember, there are people who even mild infection will put them in the hospital. People who have chronic kidney disease, chronic immune suppression, liver problems, heart problems, lung problems, COPD, asthma, very, very premature babies, or, children with congenital heart defects. These are people at risk. And when you have so many people falling sick at the same time, you just aren't able to provide the good quality of care that these people with complex medical condition needs. And that is how it will overwhelm. The concern is it overwhelms the entire healthcare system. So people who do not necessarily need to be in the hospital, just because there's no other support for them, they are going to fill up the hospital. Now, because the spike protein is so unique, so different from the original one, it is already infecting those people who have already recovered from COVID-19 once before, and it is already showing significant resistance to vaccine-derived immunity. What's the good news though? The drug does respond to stuff like remdesivir, steroids, and IL-6 inhibitors, the standard therapy for COVID-19. Your treatment of COVID-19 does not change depending upon which variant you have. New drugs are coming on to the scene like molnupiravir, which is already approved in India and hopefully in the next 3 to 4 days should start becoming easily available. And the other one being Paxlovid, which hopefully should be available in India in the next 4 to 6 months. What are your concerns? For elderly people, healthcare workers, frontline staff, these are high-risk population who are more than 5 or 6 months out from the second dose of vaccine. The antibody levels may have started to go down a little bit. So they are at a slightly higher risk. But don't worry so much. Even getting 2 doses of vaccine will protect you against severe disease for a long period of time, even though you may not have very, very high antibody levels. The disease does seem to be more weaker than Delta, significantly weaker than Delta. It causes weakness, what's called malaise, and just you feel unwell, tiredness, and might confuse doctors for dengue fever or other viral illnesses apart from COVID. And its long-term effects are still unknown. We had, like Dr. Roy mentioned, we have drugs in our cocktail, in our hospitals called monoclonal antibodies that are actually very effective as far as Delta was. Up to Delta, they were able to decrease your risk of getting severe disease by almost 90%. We expect them to still work, but maybe not as well as they were working earlier. So the question is, why do we even vaccinate? Because what vaccination does is not only does it give you antibodies, it trains your body's blood cells to remember it for a long period of time. So even if in the future you were to get infected, you probably, like a lot of you are seeing, I'm sure a lot of you have had friends or family who have recently gotten sick. When the first time they got COVID, it was really bad, 8, 9, 10 days of high grade fever. Now they get COVID, they get a scratchy throat, they get a fever for 1, 2, 3 days, they get some weakness, and within 10 days they get better. That is because your vaccines have trained your body's immune system, the cellular or T cell or memory immunity, to remember the virus and tell it, okay, this virus, this when it comes, this is what you do, and this is how you treat this. You get rid of this disease. There's almost 95% decreased likelihood of testing positive for COVID-19, depending on how soon after the vaccine you are being tested. And there's a 95% reduction of ICU requirement. And this is persistent. This lasts for up to 6 months post getting vaccine. So even, it does not necessarily matter what your antibody levels are. You are still very, very protected from going to the ICU if you've gotten the COVID-19 vaccine, irrespective of whichever one you got. This is a quick graph actually, which shows the effect of vaccination on the likelihood of getting COVID-19. The red line is people who got vaccinated. The blue line are people who got placebo, that were not vaccinated. And day 0 is the day that they got the second dose. You can see it takes around 10 to 12 days for the vaccine effect to kick in. But as soon as that, you see the two graphs spread out like that. The people who got placebo or did not get the vaccine, they just kept getting infected continuously. But the people who got the vaccine, that is the red line, you can see it almost becomes flat. That means once the vaccine became active, the ability of virus to get into your body, cause infection, that you went and got yourself tested for COVID-19, drastically reduced, in some cases as much as 95%. So bringing to the most commonly used vaccine in India, Covishield. Covishield showed 67% reduction in likelihood of getting COVID-19 when taken 4 weeks apart, which increased to 83% when it may increase to 12 weeks apart. So that is why we took it after 3 months. So then you say, why do I need a booster if it works so well? It is because for people, as far as Covishield is concerned, getting a repeat dose of Covishield causes a 300% increase is antibody levels as compared to no booster for people who check 14 days after they get their injection. So what is suspicious is, what we think happens is, especially when you get something like Omicron, which causes is so infectious and can suddenly flood your body with high levels of viruses, this increased level of antibodies are quickly able to fight the disease, especially something that is so mutated that your old antibodies, if your levels are low, it might have real trouble in fighting it. Remember, the most important way to protect yourself from a disease is to not get it in the first place. And by getting the booster shot, you're really increasing your antibody levels drastically. So the body can start to fight the infection from day 1 instead of day 3, day 4, day 5, which it might take in the event that it had to remember and start creating antibodies all over again. Also, this was also active against the beta strain. Remember, this study was done when Omicron was just coming in. But the beta strain, like we talked about earlier, had significant resistance to vaccines in a way very similar to Omicron. So a lot of studies use beta strain or beta variant to test how effective the vaccine response is against Omicron. This is a little bit of a slide. Basically, what this shows is, if you look at panel A, it says neutralization titer. This is the level of antibodies that were being able to fight the virus. The lower the number, the less likely your antibodies are able to fight the virus. So wild type is what you call Wuhan strain. You can see when they receive 2 doses, the levels are like for wild type 16, for beta it is 1.27, for delta it is 8, and for Omicron it is like 1. And you need a minimum of 10 for it to be effective. So we see, you are not able to neutralize the virus. But now come to panel C. The moment they got boosters, look at those levels of antibodies, look at those levels of antibodies that are able to neutralize your virus particles. For Wuhan type, it goes up to almost 900. For beta, it's up to 152. For delta, you're up to 430. And for Omicron, you're up to 107. So you can see now that is far higher than the level 10 that you need to actively neutralize the virus. So your antibodies are significantly more able to neutralize these viruses the moment they come in as a result of this booster. Moving now to panel B and panel C. So what this shows is Beta and Omicron are almost 18 to 20 times more likely to reduce the efficiency of your vaccine if you have got 2 doses and no booster. Delta is weaker, much weaker. So Delta is like much lower. So Delta was still very susceptible to vaccine. That is why as India vaccinated aggressively, the amount of Delta cases started coming down. But you see Beta and Omicron, they are far more resistant to vaccines, especially in people who have only received 2 doses. But now see panel D, people who received 3 doses, basically they got a booster. The ability of Delta, the ability of Beta and Omicron variant, it again drastically decreased. Look, Beta in panel B is almost 18 times able to reduce your efficiency of antibody. Once you have given a booster, that comes down to like 6 or 7. Same thing for Omicron as well. And that is the important reason why we so highly advise giving boosters. Now in this slide, and I do apologize, it looks very confusing. In unvaccinated people who were given antibodies, who were given in unvaccinated people who were given vaccine after recovery from COVID-19 in panel A. So which means these people already had COVID. 6 months after they had COVID, you can see all their antibody levels start to drop. But you see the response after vaccine, it immediately shoots up 200 times higher than what it was at 6 months after COVID. Look for Omicron. It is still 154 times higher at 6 months after they received 6 months after COVID and what the antibody levels are after vaccine. Now look at panel B. These are people who are 6 months after they got a vaccine and then they got the booster. As far as regular COVID is concerned, there's a 26%, 26 times, that's 2,600% increase in the antibody levels after they get the booster. As far as just regular COVID is concerned, the original one, the one that came from Wuhan. But when it comes to Omicron, after they got the booster after 6 months from the original vaccination, their antibody levels go up 3,800% is the increase in their antibody levels. And those antibodies are what's fighting your coronavirus the moment it enters your nose, the moment it enters your throat, the moment it enters your lungs. The more antibodies there are there, the more and the faster the antibody can get to the location and kill the coronavirus and deactivate the coronavirus before it enters your cell and starts spreading in your body. I am done. Thank you. Any questions?
Thank you, Dr. Avral. So if I can kind of make it a little simpler in language, what Dr. Avral has said so far, that first thing, that Omicron is highly infectious. And to fight with it at this point of time, the best method and best arm we have is by vaccinating again. That is the precautionary dose. Because we have seen, and all the science has shown, that it being so highly infectious that you need to neutralize it as soon as it enters into a system. So the moment we take a precautionary dose of a booster, our antibody level in the blood goes very high to 3,000 times, 200 times, 300 times. And so it's ready for virus to come in. The moment virus comes in, as I was telling you, it's like a death storm. It will get into you. There's no way of escaping unless you have been very careful. And hence, it is important that you must realize. But remember, whatever we are doing is to prevent, is to, once you get the infection, once you have the infection, then boosters will fight against the virus and prevent a serious disease. But some of us can get still the serious disease because we are compromised immunologically. We have other comorbidities which can affect us much more in spite of having a virus overload. So we can never ever underestimate the power of the prevention. the prevention still continues to be the gold standard. You need to first, in this virus, please do not depend on cloth mask. If you are insistent upon cloth mask or you cannot manage without cloth mask, you find suffocating with the N95, below cloth mask, put that blue simple surgical mask. And mask must be tightly fitting on your face. It must fit, cover your nose and mouth completely with the cheeks, and it should be in close proximity of your skin, because the cloth mask alone can just save up to 40 to 50%. But if you put a surgical mask and it's well fitting, it can save you up to 95%. So at this point of time, safety is paramount. The boosters and all those are once you have been infected. So don't go to a closed space. Even at home, when you have people and your people are serving you food or anything, make sure they all wear 2 masks and they should never take it off in presence of you. The only people who may not wear masks at home are those who are cohorting, husband, wife living in the room. They have no option. They can be without mask to each other, but everybody else will be in the mask, those especially who are serving you. And whenever you have a guest or you're stepping out, please put on the double mask or minimum N95 mask. Now, this Omicron will, because it gives a minor disease and it doesn't progress to serious disease, the home treatment and home isolation is the best treatment. For home isolation, the 5 days of home isolation is sufficient enough. What is important that if somebody gets the disease and it's positive, everybody in the house must be screened for. So we must test, trace, and treat. These are the steps which we can't avoid. Hopefully, this time the virus will not last long. The 2020, we had a virus which lasted for many, many months. In 2021, it lasted for just a couple of months. Hopefully, this will last for a couple of weeks only. But in a couple of weeks, it will affect most of the population. So I would request you all to please look at what best you can do to safeguard yourself. The WhatsApp number is not working. No, it's working. You can put up a question. You can unmute yourself and ask question. If Aviral would like to answer, if person has Omicron, what is the treatment? Dr. Roy?
Hello, everyone. Sure. Great question. So, like I mentioned, there is no difference in the treatment for depending on of the variant. So Omicron is more likely to cause mild to moderate disease. So if you have mild disease, we just give some, maybe for fever, body ache, we'll give you paracetamol, maybe a little bit, if you're having some sore throat, something like Allegra. Maybe if you're having a lot of cough, we might give you some inhalers. There are 2 new drugs that are coming. There's one drug that's come new to the market called Molnupiravir. It is in the process of becoming available. We probably will give you Molnupiravir if you present within 5 days of onset of symptoms. This does affect it. It reduces the ability of Omicron to divide and replicate in the body. So it should result in much quicker recovery from symptoms.
If I may come in, every time that we got COVID new variant, the treatment changed. The first time when we really didn't know in 2020 how to treat it. The only 3 treatments were there was oxygen and steroids, basically. Now, second time we got some antiviral. Third time we had a cocktail, but they say that Omicron may not be affected by the cocktail. But this time we got a booster. Vaccination is turning out to be a better servant and treatment agent than anything else. So we have been evolving, the treatment has been evolving as the virus is evolving. Dr. Roy, I have a question to ask. That in your, how many patients you have seen who had come in last 10 days, got infection and who were fully vaccinated? What the percentage?
All of them, 100%.
So they were all vaccinated and they were all infected. How many of them required oxygen therapy?
About of the last 80 to 90 patients I've seen in the last maybe in the month or so, of the vaccinated patients, only 1 or 2, and they also were like elderly, more than 70 years of age, along with the problems such as diabetes, hypertension, and they also had kidney disease. So they were the only ones who required to go into the air, who needed oxygen therapy.
So it is less than 1%.
Yeah.
So that's very encouraging. That vaccine has certainly helped us in controlling and reducing the severity of disease. Now, are we at this point in time right in going for a booster for everybody above 60, or what is your opinion? What do you say?
Like we saw, boosters are definitely required in the high risk population. So if you're above the age of 60, and if you have multiple, especially if you have multiple comorbidities, hypertension, diabetes, heart disease, lung disease of any sort, heart failure, if you take steroids or any immunosuppression, if you've had any organ transplant done, kidney transplant, liver transplant, um, autoimmune diseases which reduce your immunity, then you should definitely go for a booster as soon as possible.
Okay, if there are no questions, we'd like to conclude the session. And I would request all our, those who have joined us, all our participants, that please wait for next announcement. We'll have this show every Saturday, 5:30 to 6:30. We will bring the burning topic, health topic of that week to you and get the consultants, the specialists to discuss about it, and you can ask questions. And I've shared the WhatsApp number where you can send your queries. In between, if you have any, we'll try to answer as much as we can. Thank you very much. Have a great day. Thank you. Thank you, Dr. Roy. And thanks, Medica, for hosting it. Thank you all. Bye.
Thank you.
Have a nice day.